So you want to improve your heart rate variability? Yoga could possibly help. So this journal article looked at 59 studies and they were reviewed, and it had 2,358 patients. Now, a majority of these people were from India, and there were small numbers in these studies. And oh yeah, by the way, a majority of those were males. However, continuing on, the reviewed study suggested that yoga can affect cardio-autonomic regulation with increased heart rate variability and vagal dominance during yoga practices. And the reason we care about heart rate variability is the autonomic nervous system, the imbalance of the autonomic nervous system can cause a lot of problems. And so the autonomic imbalance is reflected in the measures of heart rate variability. So how well can your nervous system get it together and keep your heart doing what it needs to do? Which have been positively associated with aerobic fitness, resilience to stress, psychological and physiological flexibility. That's actually super important for you to understand. And negatively associated with cardiovascular disease, stress, neuronal atrophy, negative affective states, and maladaptive stress responses. So your heart rate variability shows you when you've worked out really hard, and now if it was stress or physical activity, now we need to recover and restore, but how flexible is your body and how resilient is it to stress? So the high frequency heart rate variability is related to the parasympathetic, which is rest and digest. And the low frequency heart rate variability is related to the sympathetic activity. Yet the interpretation and clinical significance of heart rate variability in the low frequency band have aroused intense controversy. Two systematic reviews report that yoga practices have profound effects on autonomic and metabolic activities and reduce cardiovascular risk. But in contrast, and this is why there's a review, a recently published systematic review and meta-analysis that included 14 randomized controlled trials suggests there is no convincing evidence that yoga modulates heart rate variability. So the whole story is they want to find out, does yoga affect the cardiac autonomic regulation? Now, newsflash, yoga is also about breathing. So they're really arguing, is it the breathing or is it the mental calming of your nervous system that is actually helping your heart rate variability? And they really can't decide. Most of these studies, however, are poor quality, with few studies providing robust statistical analysis. Furthermore, as many other studies of HRV, few studies on yoga and HRV provide details of respiratory rate, making it extremely difficult to distinguish changes in HRV due to changes in autonomic cardiac control and changes in HRV due to respiration. Why can't it be both? Although the mechanism by which yoga influences autonomic activity is not well understood, some yoga practices appear to directly stimulate the vagus nerve and enhance parasympathetic output, leading to parasympathetic dominance and enhanced cardiac function, mood, and energy, as well as an enhanced neuroendocrine, metabolic, and cognitive immune response. And why the bidirectional flow of the vagus nerve allows adaptive and flexible interaction between the amygdala, prefrontal cortex, and the peripheral organs, and extensive body literature suggests that this interaction also mediates cognitive, behavioral, and emotional responses. HRV therefore appears well placed to reflect the emotional and cognitive influences on organ function in the mind-body integration that occurs with many yoga practices by directly linking the input and output of the central nervous system. So this present review shows that yoga breathing practices, which are varied, will have profound effects on HRV. So breathing, taking a moment to breathe, with or without yoga, is going to be important because it's going to teach you how to regulate your nervous system. While the findings of increased HRV and improved vagal tone with yoga are consistent across most studies, it is premature to draw firm conclusions about the influence of yoga on HRV. They are unsure of exactly how the mechanism of how it works, but you do know that breathing regulates your nervous system and calming your body regulates your nervous system, and yoga does provide both. They just can't exactly say how and why. So in conclusion, when you practice yoga, this is going to include meditation, it's going to include relaxation, yoga postures, breathing, and integrating these practices appear to improve autonomic regulation and enhance vagal dominance as reflected by HRV. However, it is difficult to make the conclusion about yoga and HRV as existing studies are poor quality and use a range of measures, and none of the studies are designed the same. But changes in HRV with yoga may reflect some effects between respiration, muscle contractions, heart rate, and the reflexes that affect the autonomic nervous system. So they don't exactly know how, but it does. There needs to be more rigorous studies that will help us figure out more specifically HRV and yoga and better study designs. So in future yoga studies, you need to look at HRV, you need to report the yoga practices, and you need to look at respiration changes. Guess what we'll be doing in our study? Looking at respiration changes.